I call diabetes the silent killer. Diabetes affects your eyesight, your energy, things that you might just attribute to something else. You start to think it might be something more, but I don't really want to find out if it's something more. It takes something to make you go in and find out, oh, I'm diabetic. And if you don't get the help, it will eventually kill you. My name is Marjorie Johnson. I live in the beautiful city of Maricopa, Arizona. I work for United Airlines. I've been with them 35 years. I am in the department called customer care. My life is surrounded by the beauty of our sunrises and sunsets here in Arizona. But what I love most is this community steps up when people need help. Morning. You feel comfortable. You feel safe and secure. You feel like you're not alone. That's what it's like here.
How are you?
I don't like accessing health services alone. If I needed to find a doctor, that was just not an easy task. You've got a list of names. Your appointment might be 6 months down the road. Being able to have access to the right providers is critical. Accolade completely transformed my experience.
Surprisingly, a large proportion of our health outcomes are actually based on our social determinants of health. In the US, we're dealing with this idea of a physician gap. It's pretty hard to find a doctor these days. The physician gap is even worse for marginalized communities. They face the greatest barriers, and that those barriers actually lead to worse health outcomes. Accolade believes to close the physician gap for everybody, we need to deliver something highly personalized. And so Accolade is giving every one of our members a care team and a place to turn to get the best answers for the health for you and your family. Whether that means that they're trying to find a doctor or a therapist for their families, whether that means they are trying to get their care coordinated, or just trying to figure out how much something costs or how to get it. Accolade has a whole team of people who are just there to help you deal with that complexity in your moments of need.
Speaking to the very first Accolade Care Advocate was a wow moment. It opened my eyes to the myriad of benefits that I never used.
Accolade has a physician-led care team, but it's not just physicians. So we have primary care physicians, we have mental health therapists, we have nurses, and our care advocates.
If I need help with something, it's not jumping through all of these hoops. It's, this is the issue, this is what we need to do.
We can send you here. We got somebody for that. So.
Yes.
We care about your health outcomes, and we're advocates for you.
To know that someone is that in tune with me gave me a sense of peace.
We have a mobile app that allows our users to access all of their benefits and their entire care team that's personalized to them.
Being able to go on that app and you can find your doctor. You can get a response from your care advocate. It's very easy to do. I was diagnosed with diabetes in 2003. When I first started taking insulin, I was on 5 units a day. And by time 20 years had passed, I was up to 80 units a day.
When I was in medical school, we were all taught that type 2 diabetes is a lifelong condition. But there's been a lot of research since then that shows that in certain circumstances, it can be reversible. Accolade is partnered with Virta, and Virta provides a specialized care team with expertise in diabetes, including a doctor and a nutritionist, and together we're able to provide that service to many more members.
When Accolade introduced me to Virta, my ears perked up immediately because I had never heard those words before. I had an advocate on my side in Accolade. To have someone to be able to reach out and know that they care is something that no one should be without.
Closing the health equity gap is going to take an all of society approach. It starts with social opportunity and economic opportunity. And critically, it also includes the healthcare system, how it's paid for, how it's accessed, and the type of innovations that we make available to as many people as possible. I think that's what I love about being a doctor, is being a part of that community to help others.
I can't imagine life without Accolade. I can't imagine life without Jessica and Janine, but I can imagine life without diabetes.